We're going to start in about 5 minutes. Thank you all for those that are joining us. We're also being streamed live on Facebook and YouTube. I see now that also a news website, COO Live, is streaming the meeting live as well. Thank you, COO Live, for streaming this meeting. We should be starting any minute. Again, we are streaming live on Facebook. We are streaming live on the Community Board's Facebook page. And we are also streaming live on the news website, COO Live. And we're on Zoom as well. If anybody's watching on COO Live or Facebook, the Community Board sent out an email with the Zoom information, and you can sign into Zoom and join us on the Zoom page as well. Just having some technical difficulties. It should be resolved shortly, and we'll start the meeting. Anyway, 2 minutes till 7:30, so we're good. How are you, Rashida? Mandy, are we good? Everything working? Because somebody texted me that there's some issue with the YouTube. YouTube's working, right? You want to text Mika and tell her? Oh, YouTube video works fine. Okay, so I'm going to start the meeting, all right? Call in user one. I want you to unmute him shortly, all right? Yeah, and you're going to be you'll be monitoring, right? So you'll be able to hear. All right, great, thank you. I want to thank everybody for joining us tonight at Community Board 9's public safety meeting. We're living in difficult times, unprecedented times. The pandemic has hit New York hard, it's hit our country hard, and we all know people that are suffering. We all know people that have passed, and it's a time for unity, for community unity, a time for us to get together as one community. I think I want to open this meeting by commending the nurses and doctors that are on the front line, putting their lives at risk to protect our community, to respond to medical emergencies, law enforcement, they're out in the streets, putting their lives at risk to protect our community, the grocery stores and all essential businesses that stayed open so we should have food and have access to food, the hundreds of volunteers in Crown Heights that are delivering packages of food to the elderly and to those at risk, to the teachers who became media savvy overnight and are spending a tremendous amount of time educating the youth, to the parents that are just incredible, parenting, trying to work, dealing with their own challenges and educating their kids, and they've shown tremendous courage. Our community has shown tremendous courage and unity, and I think that this is, if we want to survive this, and we have to do this as one community together, because only together can we beat this terrible challenge and pandemic that has hit us so hard, that has hit our country, our nation, and the world so hard. Tonight's meeting, we're going to be addressing social distancing. We're going to hear from NYPD, what some of the things that are allowed, some of the things that aren't allowed, how summonses are issued, and how the police enforce the law, and what's been happening in our community with crime and social distancing, and some other updates. We will also hear from a doctor that will discuss some of the medical aspects of this pandemic, of this disease, and we'll be taking questions from the community, from community members. There's an option here. I think you could raise your hand, and Mendy Margolin will allow you to ask questions. First, we're going to be taking questions from committee members and then from the broader community. Mendy, please unmute call in user one. All right, we have on the line with us Detective Vinny Martinez from the 71st Precinct. I'm going to ask him to open up with giving us a quick rundown on crime in the neighborhood, some of the things going on with social distancing, and how the community is responding, and what we're allowed to do and what we're not allowed to do as a community during this difficult time.
Hi, good evening, everyone.
Good evening. We could hear you.
So the 7-1 last 28-day period, overall crime is down 42%. The one thing that is rising are stolen vehicles. We're starting to see that resurface again, the stealing of cars. A lot of that is because the new cars have push button keys, and people are leaving their cars running, and people are jumping in and taking them. That contributes to a lot of the rise in our stolen vehicles. Unfortunately, last night, we had a young man shot in the back twice, according to Uni and Utica. He will survive from his injuries. He's a little uncooperative with us. He's known to us, has a past criminal history with us, and we believe it was from an argument that happened the day before at the corner of Utica and Eastern Parkway. Unfortunately, early in the week, we had a homicide at 200 Winthrop Street. We had a young up-and-coming rapper shot multiple times, who's deceased. That's early in investigation, but right now, most parts of that investigation is leading to gang activity and being the motive to the homicide. 311 complaints. We have a couple of hot spots with 311 complaints this month. Beekman Place, Sterling, Ebbsfield, and Winthrop Street. With the rise of COVID, we're seeing a lot of social distancing calls called in for those particular areas. When we get there, however, and to date, the 711 has not issued any social distancing summonses to anybody from any community. But what we are finding in these locations are issues we had prior to COVID. We find groups of people gathering, drinking, playing music, and unfortunately smoking marijuana on the street. So when we do come across these things, we issue a warning to disperse 6 feet apart, and we play the mayor and governor's warning messages. Sometimes we do take enforcement activity at these locations, but that is primarily for drinking, smoking marijuana, for urinating, and unfortunately on occasion throwing a bottle at the police. But we have not issued any summonses for social distancing. Last month, these same locations were also an issue. 770 Eastern Parkway was an issue, mostly because of the Passover holiday and because the Jewish community is about 25,000 strong. We have a small group of maybe 100, if 100 people who are really fanatical religious, and they're outside praying in front of 770. However, they are staying 6 feet apart. It's not a large group. We are monitoring that situation. Last month there was an issue. This month it seems not to be an issue. As we go on, summer's getting here. It's going to be hard to keep people inside the house. We understand that, especially with kids. Some parks are open. The playgrounds are closed. We will continue to monitor all locations. We have not issued any social distance summonses to anybody. We like to keep it that way. We don't foresee it being an issue in the 7-1. We will play the message. We will tell people to stand 6 feet apart, and we will continue to tell people to disperse. People have been listening to those messages. We don't see it becoming an issue. Earlier today, Community Board 9, we went to a couple of commercial districts today and yesterday. We handed out over 10,000 masks to people. The community, the 7-1 community as a whole, Crown Heights, every part of the community, I will say, has been very responsive to the mayor and the governor and their warnings and with social distancing. We had a couple of churches that we know were open one way or another. There are a couple of funeral homes that are open. Obviously, unfortunately, we have to bury our family members, unfortunately. And then we've had, like I said, the issue of 770. We will continue to monitor them. Our main goal is to not to issue any social distance summonses. I don't think we're going to have to, but there are some hotspots, like I mentioned, that are popping up where there are other quality of life issues, concerns that are concerning to us with the summer coming in, mostly the drinking, the marijuana use, and the loud car playing. But those were an issue before Corona. So we'll continue enforcing the quality of life issues. We don't foresee any issues with social distancing. We'll continue to stay on it. And like I said, we kind of have a command structure set up that before a summons is issued for any of that, we kind of have a checklist and a call up the chain, if you may, for the 7-1, going through us, through our CEO before we issue any of those summonses. We like to keep it that way. The community's been great. Every community's been great. People are listening. And I don't foresee it being an issue as we go into the summertime at this time. And again, crime is way down. Hopefully it stays down. It stays way down. With the only rise we're really seeing is in stolen cars. So with that, I'll turn it back over to you.
So Detective Martinez, I'm going to ask the first question. I'd like to open it up to some of the committee members to ask questions. And I noticed that our board chair is here, Fred Baptiste. So I'm going to ask Mendy to open his mic in a second. But I think there's a lot of confusion are community members required to wear masks when they leave their homes? Are they not required? Can you talk about that for a moment? You know, I see some people are wearing, some people aren't. You go to the parks, half the people in the park have, half don't. What are the requirements? Am I required to wear a mask when I leave my house in the morning, if I leave my house?
So if you leave your house in the morning and you are able to do social distancing, say 6 feet apart from people, you are not required to wear a mask. However, this city is a very crowded city, as you all know. We all live on top of each other. Once you go shopping, most stores will not allow you without a mask. Once you enter the transit system, you need a mask to ride transit systems. And just for your own health, you should be wearing a mask. Part of the problem with this corona is it's spread through people who will never show symptoms of it. So you can be totally healthy today and not know it, and you can not wear a mask. And we see this a lot with kids. Kids are outside without a mask on. Kids, the bulk of them are asymptomatic, so they're not really showing symptoms of it. They could become infected and bring it home, and then they could bring it into your house. So we suggest everybody wears a mask, but if you're able to stay 6 feet apart from each other, no, you're not required to wear one. Most stores entering, you are required to wear a mask. The transit system, you are required to wear a mask. If you're in if you walk down crowded streets and you can't stand 6 feet apart, then you will be required to wear a mask. But really, you should be wearing a mask for your own safety and for your own family's safety at this point. But no, out in the public, 6 feet apart, you're not required to wear a mask.
Thank you, Detective. Obviously, we encourage the community. We ask the community to follow the recommendations, to wear a mask, to follow the law, to keep social distancing. This is a matter of life and death, and obviously we don't agree, and we absolutely are disgusted by the behavior in front of 770 that you mentioned earlier. And this is not the behavior of the Jewish community. It's a select few, and every rabbi and leader in the Jewish community has criticized this behavior. And it should not. We don't want it. We support the police and whatever steps necessary need to be taken to enforce the law at that location. Mandy, please open the mic to our board chair, Fred Baptiste, to see if he wants to comment or ask any questions. Fred, your mic is off.
Thank you so much, and I'll be very brief. This is your committee. This is your meeting. But I did want to thank you, and I wanted to thank all the members of your committee for doing this. This is definitely a period of uncertainty in terms of we haven't really operated in this manner before. So I really want to commend you in terms of being able to come together and do this, and to reach out and to get, to reach out to the people who have, information to give to us. There's just a lot we don't know, so this is great and fantastic. I definitely wanted to thank Detective Martinos and the 71st Precinct again. I mean, you were partners before this, and you've definitely still continued to give the same kind of excellent service you've always done. I just wanted to thank you. Everyone be safe, and please continue with your agenda. And if there's anything you need from me, please let me know. Thank you.
Thank you, Chair. And condolences to you, Fred, as well. I know you lost a family member. We're sorry,
so
our hearts and prayers.
I really appreciate it.
It's a difficult time. Mandy, you want to unmute? I mean, Rashida's on the committee. You want to unmute Rashida for a second, see if she wants to comment or ask any questions? Rashida, are you muted? Oh, Rashida, you're
Hi,
muted.
thank you, everyone. Actually, I just had a question. I just wanted to find out, it's good to know that I'm here about this, no summons has been issued, and for the majority, everyone in in our area is actually, utilizing the social distancing and listening to what they need to do. How has the NCO program, the NCO officers, how are they being utilized to, I guess, interact with the community? Has that been effective?
So the NCO program is just, so let me just back up. When coronavirus hit, the 7-1 was one of those commands in the beginning that was hit very hard in the beginning. 47 officers tested positive for corona. At one point, almost half the precinct was out sick. Everybody that was in what we call a specialized unit, the NCOs, domestic violence, anti-crime, was taken to backfill patrol to make sure 911 and emergency response was kept up to speed, and we pulled through that. in the last week or two, we're finally getting back to normalcy. Our sick levels are all the way down. We're back to full staffing. So we're also, when we were down, the officers, Mont Police Plaza, sent an additional 20 officers to help us with patrol functions to get through this time. Since those 20 officers have now returned from where they came from, and we are almost back to 100% full duty, 7-1. So lately, the NCOs now are back online, and they're back out there again doing what they do with community, interacting with the community. They've been great dealing with the crimes we have seen and with these quality of life concerns we have, especially along this Sterling and Beekman, Nibbers Field. They've been going there trying to monitor the situation so they don't get out of control, and they know who the community members are and the main people are at these locations. And when they have to take enforcement because they feel it's getting out of control, they do. And when they don't, they're able to verbally warn people, and they're able to mitigate the circumstances where enforcement's not necessary. So they've been at the forefront with these 311s and these crack locations, Beekman, Winthrop, Sterling, and they've been out there in the community, making sure that these situations don't go out of control. Unfortunately, we've all seen some of these videos where it's gone out of control, and they've been in the front of the patrol cops, making sure that we don't have these situations that we've been seeing in some of these videos.
Thanks.
Thank you. Are there any board members or committee members that want to ask a question? Mendy, I guess they're going to wave at you. I'm not really sure how. Are there any board members or committee members that want to ask the detective a question? Mendy, unmute yourself for a second so you could respond. Can they wave at you? How will you know that they want to ask a question?
If you want to speak, if you just, where is it? If you click on reactions, no. What the heck? There should be someplace where you could raise your hand.
You have on the right side of the screen, it says raise hand, like I'm doing like that. I just did it. Raise hand.
So that will let us know that you want to speak.
All right.
You can also chat us in the chat window as well.
Is there anybody else that wants to ask a question to Detective Martinez? All right.
Okay.
There's no raised hands, correct, Mendy?
That is correct.
So it looks like I can't, Mendy, it looks like there's a comment there. Oh, Alicia Boyd wants to ask a question. All right, you want to unmute Alicia for a second? Alicia, you're unmuted.
Hi, there's underneath the administrative iPhone. I don't know her name, but she has glasses on. She's been waving her hand for quite some time.
No, it's a wave. You have an option to raise your hand on Zoom, and we know
Yeah,
you
but
want.
I don't know where it's at. She doesn't know where it's at.
All right. So let me try to find who you're talking about. Thank you for bringing it to. It says administrators.
iPhone.
Thank you very much, Alicia.
But I still have a question.
All right. Ask your question.
I still want my question. I still have a question.
All right.
So you're gonna take her, or you wanted me to ask?
You'll ask your question, then we'll go to administrator's iPhone. Then we're going to ask Mr. Pearson to introduce Dr. Heft.
Okay. Well, I just wanted to say that I'm happy that there's a lot of concern that we have in the Black community about the policing. And so I'm happy to hear that the 71st precinct has not sat there and given out any tickets, because that is a very sensitive issue in the Black community at this point in time. There has been videos that have been going around in the Black community that's quite disturbing about how the Black community is approached. Now, you mentioned, Detective Martino, that you over on Sterling Street. So I live on Sterling Street. So I just would like to know a little bit more details about that. I don't know what you're referring to. And also I would like to just clarify, like when I sit on my porch, I do not have a mask. And I might have, one or two people sitting on the porch with me. is that then going to be an issue? I mean, what are the requirements of when you're on your own property? You know, is the city allowed to enforce this law within people's own property? So those are the two.
Thank you for your question. Detective Martinez?
Sure. So the part of the issue we're talking about, we're referring to, I should clarify this, is between Nostrand and New York Avenue.
Okay.
In the last 30 days, we have over 33 111 complaints about that block for a combination of things. Obviously now, because COVID-19 is here, everybody groups in social distancing with a lot of these phone calls. However, when we get there, we find more than not a group of 20 people drinking, using marijuana, and playing loud music. And then they just happen to throw a social distancing code in there. So we call this code as social distancing, which really is quite a life issue we're having there via 311. This is nothing new. That one location, it's been a chronic location for us, for years with people hanging out. Obviously, there's a park right there. There's basketball courts over there. Half the block no one lives on, so people tend to go to that location just to hang out and stay. Like I said, the NCOs, they do respond there a lot, and a lot of times it is people just hanging out doing nothing. They ask them to social distance, they comply, and they go on their way. Sometimes, unfortunately, we get there and we have to issue warnings for drinking and smoking marijuana and shut the music off. Most of the times, 99% of the times, we will go back around to make sure they comply. A warning is issued, and if they don't comply, then we issue quiet life summonses for smoking marijuana, for drinking, for loud music, but not for social distancing. We have not. So that area is Sterling Street by the park, New York to Nostrand is the area we're referring to. It's been a chronic. It's been a chronic for a while. We're trying to clean that area up a little bit with quiet life concerns for people who live there who are calling it in. As far as you being on your porch, that is your private property. We cannot enter private property to issue a C summons unless we feel it's being used for a commercial location. So you sitting on your porch with 3 people, we will not do any enforcement, nor should we. However, we do have incidents where people are trying to take advantage now because the bars and clubs are closed. We have not seen this in the 7-1, thank God, but we've seen this in other city areas where they're advertised on Facebook or Twitter for parties, and they would turn their private houses into a commercial location for gatherings. So that kind of changes the way we do things. Once you open up and you're charging a fee to get in, or you're advertising, you're now saying you're sort of like a commercial location, so that we will enter your facility. But if Alicia, today I drove by and I saw you out there with your 2 friends, no, you're absolutely fine to stay on your property and speak to your 2 friends. Now, whether you want to wear a mask or not, that's up to you. But you are perfectly within your legal rights to do so, and we're not taking enforcement against that, nor should we.
Thank you, Detective. Mendy, Administrator's iPhone is waiting to talk. And I think I saw Mr. DeHaan also wave his hand. I think Mr. DeHaan also has a question. Oh, no, he doesn't have a question. No, okay, I missed so. Administrator's iPhone, yes.
Yes, thank you, Chair Yakov Berman.
Introduce yourself,
I saw
please.
you on
It
Facebook.
It doesn't say your name.
Oh, good evening. This is Tessa Hackett. Yes, this is Tessa Hackett Vera, CB9 board member. Thank you, Chair Berman. I saw you on Facebook doing some food distribution in the community, and that was a commendable thing. Thank you, Officer DiMartino. It's good to hear an updated criminal justice report from the NYPD in general and the 71st precinct in particular. I was just wondering, the summer is coming up, and what do you foresee or forecast would be the general lay of the land in the 71st precinct for gatherings, issues around the park, Prospect Park, some of the smaller park, the park on Lefferts and I think, what is that? Kingston, Troy, Schenectady, whatever that park is over there. What do you anticipate to be the law of the land as summer, June and July and August descend upon us? What do you forecast and foresee?
Thank you.
All right, so hopefully as the summer rolls in, hopefully the parks will reopen. We'll be back to some kind of normalcy. But with that said, that is my hope. A lot of these locations, a lot of the parks we have in the 7-1 are generally closed right now, with the exception of Wingate Park, the exercise area, and Ronald McNair Park. And obviously Prospect Park doesn't fall in our command, so that park is open also. As summer rolls in, we do foresee issues with people coming out. People are going to come out. The weather's going to be nicer. Our cops will be out there. We will play the message. We'll ask people social distance. The mayor has a program where he's going to give us X amount of people to help with the social distancing as ambassadors. So I'm sure, within a couple of days, we'll have a plan how to work with them to get them out there. A lot of the issues we're really seeing now will probably plague us through the summertime. Sterling, Beekman, Winthrop. Traditionally, they've been issues during the summertime throughout the past couple of years, and we foresee them to continue to be problems. We will continue to put resources into these locations. Some of these locations have steady police officers assigned to them. Others have light towers. Other ones, our supervisors know when they come over, require an immediate response. So we'll continue to monitor those locations, covert or not covert. These locations have been historically quite a life concerns for us. Realistically, I believe we're one of the most densest populated communities in the city, with over 100,000 residents and a little bit over 1 square mile. So with that said, there's gonna be a lot of people looking to come out with the warmer weather. People's front yards, their porches, the street in front of them, the corner, that's their backyard. They don't have backyards, they live in apartments, we live on top of each other. So we have to be conscious of the fact that people need to come out and get some fresh air, and we'll deal with it as we go on. We haven't had an issue yet. I don't foresee us having an issue with social distancing. Our cops pretty much have mine and my partner Mike's cell phone numbers, and when community concerns arise, they call us 24 hours a day, whether it's 7 o'clock in the morning or 3 in the morning. They always reach out to us. We always answer the phone. And if me and Mike have a question, we will call our commanding officer up, who's always available to us. But we don't foresee any issues going in the summertime as it goes to crime-related issues or social distancing issues. We continue what we're doing. We've had a good formula going here in the 7-1, and hopefully we're able to keep that going. If we have to adjust, we'll adjust. But right now, I think what we're doing is working fine. Our officers are calling us. We're making on-the-spot decisions. And like I said, the CO is heavily involved with everything we do. And we're going to continue doing that. We realize people live in the city. They don't have backyards. They don't have front yards. They need to get out. We realize we have a group of people's gatherings. We know that. We will continue playing the message, asking them to social distance. If we have masks available, we'll pass them out. And like I said, when it comes to enforcement, we're only doing enforcement quality of life issues when people are drinking, smoking, or loud music playing, because whether COVID's here or not, that's always a quality of life issue. So we'll continue doing enforcement against those. But with social distancing, we will do every effort possible to mitigate that. And we've been very successful, and we have not issued any of the summonses yet. And hopefully that will continue through the summertime.
Detective, I just want to point out, in reference to the question, that the governor's executive order and some of these recommendations and laws have not yet been extended through the entire summer, correct?
That's correct.
So we don't know if it's going to be stricter or less strict. We're assuming it's going to remain in place, but as of now, we don't know yet what's going to be. It's day by day.
Right, and what people need to understand is what we say today, tomorrow morning could totally be a 360. So we're going what we know with today and the information we have today. Tomorrow could be totally something different. Next week could be something different. we will continue to evolve as this evolves.
Detective, I want to thank you for coming on. I want to thank you for everything you do for this community, the 71st. I know you were not feeling well as well. And thank you for coming out every day to work despite the challenges and with everything going on. You've been great. And we really, as a community, as a board, we appreciate everything you do for this community. Even now, staying up late, staying in the office late to come on this call and speak to the community and hear our concerns. We really appreciate it. And thank you so much.
Thank you. Let me just leave by telling everybody, please stay safe. People in the community have my number. If you have a question, please call me. We're very accessible, me and Mike. And I just want to thank the community in general. The community has been absolutely great with this. I don't see the issues or problems that I see in other precincts and you see in the papers. And I wanted to personally, me and Mike, thank the community, every part of the community for helping us out. It's a team effort. It's a two-way street. And the community by large has been absolutely wonderful during this crisis. Hopefully it'll be over soon. And I want to thank everybody and please be safe.
Thank you, Detective. We're being streamed now live on Facebook, on COL Live, as well as on Zoom. We have a full meeting here. I see there's 21 participants. That's great. That's better than some of our in-person meetings. I'm going to ask Mendy to please unmute Jacob Pearson, who's going to introduce Dr. Hecht. Jacob, we thank you for your service. I know the last 2 months you've been volunteering and visiting the elderly and the sick and bringing food and delivering masks. You're on the streets every day despite the challenges. And as a community, we appreciate what you've been doing for this neighborhood over the last 2 months.
Thank you, Yaakov. I want to start off by thanking all the frontline healthcare heroes, including Dr. Hecht, who I'm about to introduce. Dr. Dover Hecht, he's originally from Chicago, Illinois. He did his rabbinic ordination in Los Angeles, California. He's a rabbi doctor. He actually studied here in Brooklyn for a bit. He went to Terrell College. He started his pre-med here in Brooklyn, and then went on to join a post-bac program, and he graduated from the Lewis Katz School of Medicine at Temple University in Philadelphia. And he's currently at the Harbor UCLA Medical Center in Los Angeles, California, where he's studying internal medicine. And he will eventually specialize in infectious disease. And he's been, studying this virus, and he knows a lot about it. And his biggest accomplishment is that he's married to my sister and the father of my nephews. So he's my brother-in-law. Without further ado, Rabbi Dr. Dover Hecht. And if anybody has any questions, you're welcome to ask him.
Mandy, unmute Dr. Hecht, please.
Hi, Yankee and Yaakov, and hello. Can you hear me?
You're live.
Thank you for joining us.
Yes. Thank you. Thank you for having me on. I wanted to agree with one thing that you said and disagree with the other one. The one thing that you said, my greatest accomplishment was marrying your sister. I agree with 100%. The thing that I disagree with is that I don't know a lot about this virus. And I don't think, unfortunately, anyone knows enough about this virus. And in the beginning, when people were reading up about this virus, it's called a novel coronavirus, which means it's a new virus. And new viruses, take time for folks, even within the medical community, to really fully understand. And viruses have been around longer than humans, so they are smarter than us. And I think that there are a lot of people who are maybe upset or not kind of on the same page as the folks in the government and from the CDC who have been giving recommendations, and they're upset that the recommendations weren't perfect. And I think that a lot of that is because we have to understand that this is a new virus. And what I tell people who ask me questions is that we always have to stay humble, because we don't know everything, and there is so much more that we don't know than what we do know. And that being said, this has really hit New York. Really, it's disproportionately more than the rest of the country, and you guys are going through a lot. Many people have lost their lives. Many people are injured. Their lungs are injured post-virus. They are going through, extensive physical therapy, occupational therapy, on, different kinds of medications because of complications of this virus, and people are suffering. And even those who haven't, who are doing okay and have had the virus, for those who haven't had the virus, many people are suffering financially. And that's something that we are 100% cognizant of in the medical community. And we just have to continue to be compassionate and empathetic. I'm sorry, I'm just getting a page right now. Compassionate and empathetic towards our patients. That being said, California is seeing an uptick in cases now. We aren't exactly sure why, but we think that probably it has to do with lack of, people are being a little bit more nonchalant. And I'm getting another page. I'm sorry, guys. I didn't ask them to page me. And people are being a little bit more nonchalant about the social distancing, which is, it's difficult. It's understandable. And, it seems like New York has had, their wave has come and gone at a huge cost. But again, this virus is something that we don't fully understand, including really tough questions like long-term or even short-term immunity. There are a lot of studies going on now about that. And really, many of them are inconclusive. I just was on a conference call similar to this with some scientists who are really aggressively studying immunity in this virus. And what what they have found is that we don't really know how much. We know that people do develop antibodies, but that doesn't mean that they necessarily have immunity. All this is just to say that you guys are doing your best. We're all doing our best. We're all in this together. As a doctor, I continue to follow up with as an internal medicine doctor, I continue to follow up with my outpatients on a regular basis via phone. I am able to, if I feel like it's unsafe for them or they need to see me in person, I tell them to put on a mask and come in or get lab tests if that's what they need, because we have to weigh the benefits and the risks. And in some cases, the benefits of them getting immediate attention by me prevents them from potentially going into the ER. And so I encourage everyone to continue to follow up with their primary care physicians or specialists like cardiologists or GI doctors or nephrologists or kidney doctors, because it's important for us to be on top of what's going on with our patients, even while they're staying at home. And even if you don't see the physician in person, there's a lot that we can do over the phone. And we're actually discovering now how important telehealth can be. And even after this virus hopefully goes away, telehealth will probably be a big part of medicine. I don't really have a whole lot else to say about the virus in New York per se. I am definitely open to taking questions, and I'll promise to answer them as best as I can.
Great. Thank you so much, Dr. Hecht. Yankee, you want to take questions for Dr. Hecht? We'll do the same thing. If wave your hand, raise hand. Is that Alicia Boyd again?
Yeah, Alicia has a question.
Mm-hmm.
You're unmuted, Alicia.
One of the questions that people are asking that seems to be going around is the idea that another wave will be coming, that after looking at viruses and the history of viruses over the last couple of centuries, that there's always waves coming. And so what is the projected next wave? And also I have one other question after this.
Sure. That's a really, really good question. You know, in the past, as exactly as you have mentioned, most viruses, and especially pandemics, and in particular, the one that we're looking at closely is the 1918 flu pandemic. The second wave was really deadly, and it actually killed more people than the first wave. Now, there are many differences between influenza flu, you know, the common yearly flu, and coronavirus in general, which I won't get into right now, but it is entirely possible that there will be another wave next year. And like I said, it, you know, the projections is that it will occur in the winter time, but it's really difficult to know what kind of quote unquote immunity people have had. Specifically, I mean, if you take a place like New York, for instance, if you presume that a significant portion of the population has been exposed to the original, you know, SARS-CoV-2, the cause of COVID-19, then you can postulate that the new wave that will come won't be as bad in a place like New York, because you have at least some sort of relative immunity in the community. However, we don't know that for sure for a few different reasons. One is we don't know what kind of immunity people have. What we have been seeing in early studies is that people who have had the virus really like aggressively, who have been hospitalized for it, seem to build stronger antibodies, seem to have better immunity than those who have had the virus kind of like, you know, very mild symptoms, although that hasn't been fully proven yet. But regardless, it is possible that the second quote unquote wave that can potentially come will be a different strain of coronavirus. And there are many coronaviruses that are, it's a common cause of the common cold. But this virus, if it does mutate, could potentially be, you know, as bad or worse than the current one. All that being said, we don't, like I said, we just don't know for sure. I am going, you know, based on the projections from, you know, from the studies that they've done, looking at previous viruses, studying how this coronavirus works. But, you know, again, we really don't know. And, you know, we're wrong a lot, and that's okay. We just have to be, like I said, we just have to be humble and understand that we are wrong a lot. We have to be prepared, but not scared. So that's what we're doing. We're trying to prepare as much as we can. One of the reasons that this virus was so deadly was because we were unfortunately unprepared. And so we're going to do our best to prepare, and hopefully, you know, one of the silver linings is that we have learned from our mistakes, and we can prepare as best as we can. I don't know if I answered your question, but I would say to not be anxious about it. I know that that's kind of difficult. It is definitely possible, but we just, you know, we prepare for the worst and hope for the best.
Alicia has a follow-up question, and we'll move on to the next person.
Yes, one of the concerns that am I speaking? Can you hear me?
Yeah,
Okay.
I can hear you.
Yeah.
One of the concerns that we had was the fact that certain groups of people in our community, you know, when they go into certain areas, feel like they don't have to sit there and participate in social distancing, either with the mask or with staying apart. And even though these communities are very tight knit and maybe very maybe homogeneous, they do kind of extend out into the other community. And so how much concern should we have if there are groups of people and groups of communities who are not engaging in the safe practices that other communities are having? So that means is if my community is engaging in safe practices, but there's a community next door to me that's not, how much concern should I have for that community's behavior?
Well, Dr. Hecht, before you respond, can you clarify what community you're talking about?
Yeah, well, there's been a lot of videos about, like on Kingston Avenue, for example, you see a
Dr.
lot.
Hecht, please do not respond to this question. Thank you. Yankee.
Why not? Why not?
Yankee, please move on to the next person.
Okay, does anybody have questions here regarding COVID-19? Do we see anybody raising their hand?
Let's put on the chair again for a second, Fred Baptiste.
Yeah.
Fred,
Yeah, very quickly. I just had it in the chat. I'm not sure if anybody saw it, but I know that, we see all this stuff in the community about, okay, well, in the literature, N95 masks are supposed to be for, first responders. And you go into a store, you see something with a KN95 on there. And if you go online, you'll see different things like PP2 or all different kinds of indicators on there. What's appropriate, or what provides at least a baseline level in terms of at least you're somewhat protected? Understanding that you want us to keep the N95 mask, but is the KN95 mask worth it? Or if you're walking with a dust cover on your mouth, respirator, is that even enough protection?
Yeah, that's a really good question. So these studies have been done already. And if you could see, I'm currently in the hospital right now and I'm wearing a surgical mask. I'm seeing patients right now who my current patients have been tested negative for COVID. However, there have been patients who have tested negative and then tested positive, mostly due to lab error. To answer your question, for a regular civilian, like say you're walking into a grocery store, you should try your best if you don't have to, like if you're just going in to get a chocolate bar, it's probably not the best idea to go in just for a chocolate bar. You should probably limit the exposure to other people in general as much as we can. A regular surgical mask or a mask that's gonna cover your face is sufficient for just people who are in the community. It's a virus. I'm sorry.
We are gonna stop in Lakewood.
Okay. So it's an airborne.
Mandy, who is not muted?
Yes, is on.
Joe.
If you want anything from
Joe, yes, Joe Rappaport, you're not muted.
Okay, he's muted now.
So for the regular civilian, I would say a surgical mask. There are many. They're available now. Healthcare workers, most hospitals, at least in California, and for what I'm seeing in New York, they're not having issues with running low on surgical masks. But if you can't afford that, there are many masks online. There are many masks online that are fairly cheap and reusable. Those are okay to use for the community when you're walking out. If both people are wearing masks and they're socially distant, it's extraordinarily difficult to transmit the virus. People who are at highest risk and need to wear the N95 respirators, not the KN95, that's different. The full N95 that needs to be fitted, usually by the hospital people who do this, the nurses who usually are trained to do this. Those are reserved for people who have high risk, very high risk exposure, like emergency medicine physicians or anesthesiologists or nurses who are part of or respiratory therapists who are part of an intubation where there's a very large viral load that is coming out of that's being emitted in the room in a small in a small, uncontrolled environment. So those are the people that we generally reserve the masks, the N95 respirators for. So to answer your question, in short, yeah, a regular mask or any facial covering that you can get is okay if you're walking in the street or in the store. And you just, and most people, at least in California, are wearing masks, and it's required when you go into a store. And that will probably be part of the regular day-to-day life until we come up with a vaccine.
Dr. Hecht, I just got a text over here. If you could address a question of, in every community, you have people that are following the recommendations and the rules, and you have people that aren't. We see across the board, you go to the parks, you see from every community across the board, there are those that follow and those that don't follow. As you know, I recently got married. My immediate family was there, and we had two witnesses. Mendy was there and one person. I had nobody by my wedding because we wanted to follow the law. So how does that work? You go to the parks, you go down the street, you see some people are being very careful, others are not. How does that work? How is the broader community going to be affected by the fact that some of us are doing what we're supposed to and others are not? From a medical standpoint.
Yeah. I'm going to be careful how I answer this question. I think that Ms. Boyd, I think that was a totally fair question. From the medical standpoint, it's really difficult to know if, say, like one community is, I'll give you just an example that's outside of New York. Like, let's say on a college campus where there's a lot of really young folks who aren't that worried about getting the virus because statistically they're okay. But then, for instance, if they all congregate and get the virus and then go visit grandma at home, that is problematic. It is problematic. Now, I can tell you just based, scientifically, that it is problematic if you're exposed to people who are congregating together and who likely have a higher statistical chance of contracting the virus. And that being said, from a policy standpoint, I generally try to stay away from that. It's not my lane. But I do know that it's frustrating and it's really upsetting when some people are following rules and others aren't. There isn't a whole lot that we can do about it other than trying to educate people and to do the right thing. I don't know what else to say. I know that there have been studies in Pennsylvania, for instance, where I went to school at Temple. We have the community is predominantly Black community, and it's an underserved population. And we are getting at Temple, which I'm very proud of to have worked with an underserved population, by the way, which I continue to do here at a county hospital in Los Angeles. They have been disproportionately hit by the virus more than other people. And a lot of that probably has to do with social determinants of health. People aren't, which has been a long-standing issue in the African-American community, mistrust of physicians and nurses because of bad outcomes, unfortunately, and many other social determinants of health that have been well documented and researched. And that's not going to be different for any disease, including this virus. I think that some of those issues probably carry over to communities that are close-knit, like an Orthodox Jewish community, where there are a lot of some of the same issues, like mistrust in authority and things like that. So I think New York has really been hit hard. A lot of people have lost loved ones and have been really damaged by this virus. And I don't know if I answered your question, but it's upsetting for sure. And I don't really know from a policy standpoint what else I can add.
All right, Mendy, you wanted to say something? You wave your hand.
Yeah, I just want to say that somebody wrote here in the chat that there's a claim that 90% of the virus came from the Jewish community. yes, it's true that many members of the Jewish community got the virus, and that was due to the fact that for the same reason why the virus even came to New York. This virus was hanging around in New York for months, for at least a week or 2 weeks before. And it happened to come at an intersection with the Jewish holiday. To say that 90% of the virus came from the Jewish community, in my opinion, is a libelous statement, and I am offended, and we should not tolerate that type of sentiment.
And I happen to agree with Mendy Margolin. It's incredibly dangerous rhetoric to blame one community or make allegations. This is a virus. It's nobody's fault. Everybody should keep the rules. We encourage everybody to keep the rules. You're not just putting yourself at risk, you're putting others at risk. But if you go into streets, the parks, the bridges, you'll see that they're members of every community. They're behaving the way they should be behaving, and they're members of every community that aren't. I think we should not generalize, and it's very dangerous to generalize. And I appreciate your comment, Mendy Margolin. Are there any other questions for Dr. Hecht?
Yeah, Debbie is raising her hand.
Debbie Timothy.
Yes, thank you. Hi, doctor. I have a question with regards to vitamin D and how does that weigh in with the current virus? I can't hear you. Can't hear him.
I'm sorry. Yeah, that's a really good question. I'm not familiar with any studies that show that vitamin D, that excess vitamin D intake prevents the virus, or that people who have an adequate vitamin D level in their blood do better with this virus. And that being said, I have to be careful with the kind of advice that I give because I'm a doctor and I don't want, this is not any advice, but I will say this. Probably I didn't look up this statistic before I came on, but a large portion of the population, including myself, by the way, are vitamin D deficient. And so it's not a bad idea. If you're vitamin D deficient, you should probably be taking vitamin D supplements to replenish your vitamin D levels in your blood. Vitamin D is really, really important. It helps us digest pretty much everything, and it works on the kidneys. It works in the gut. But one of the big things that it does is it really strengthens our bones, and it helps us absorb calcium, which is really important for us to have as well. So I would ask your doctor that question. I won't give general, because I don't know, what kind of, each person is different, but, and this is also the caveat of, folks who have end-stage renal disease or CKD or chronic kidney disease should be careful with vitamin D intake, but they usually do need vitamin D. Older women who are postmenopausal usually should be on vitamin D and calcium, as well as, getting regular checkups with their DEXA scan to make sure that their bone mineral levels that they aren't deficient. Their bone mineral density is appropriate. So vitamin D is really important for people to have an adequate amount of vitamin D. Most people, I can safely say that, are likely vitamin D deficient. The fact that we can't go outside and get the best source of vitamin D, which is from the sun, is also an issue. So I think that you could, if you're a young, healthy person, or even if, you don't have too many medical issues and you've been told in the past that you're vitamin D deficient, older females, it's pretty safe to take vitamin D daily, 2,000 to 5,000 IU of vitamin D daily. I don't know that it will protect you from coronavirus. I haven't seen that studied, but I do know that it's going to be good for your health because you need to have an adequate vitamin D level.
Thank you.
Thank you, Dr. Hecht. Any more questions? Yankee, any more questions?
I just want to say that we gave out about 5,000 masks so far, and I do have some additional masks here. So if anybody here needs a mask, the surgical ones, a 3-ply like Dr. Dober is wearing, I do have extra ones. So just reach out to me and we'll figure out how to meet up. Does anybody else have any questions? How about the Chair Fred? Do you have any more comments or questions? Anybody else have any questions or anything? Any comments? I see Mendel Persian is commenting. It's chatting. Maybe he wants to ask a question or say something. Oh, I see the admin is raising her hand.
Oh, administrator's iPhone, man. You want to unmute it again?
Let's start with Francesca.
Thank you. The question is based on what Debbie just asked concerning the vitamin D, and there is a theory about even in the Caribbean that there is a less percentage of the virus in the Caribbean, and there's a theory out there is because of the heat. There's no coal in there. So what's the connection between the virus and the heat in the human body?
Sorry, what was the last thing you said?
What is the connection between the virus and the heat, right? Was that the question?
Yeah.
And the heat. That's a
Yeah.
really good question. It's been studied, and it looks like heat does kill the virus in vivo, excuse me, which is in like laboratory setting. However, we do see that there are places that have a warmer climate, and they still do have a lot of cases of coronavirus. In particular, if you look at a place like Florida, Florida did have a big cluster of cases, especially early on before after they had the arrival of the USS Mercy that came there and people went out unchecked. And then, they did initially have social distancing that helped out. However, there is that theory out there. I can't, confirm or deny that. It does look like in vivo, like I said, like it does kill the virus. That being said, if somebody is carrying the virus, right, and you go ahead inside with that person and you congregate inside, it doesn't really matter what the temperature is outside, that if somebody sneezes or coughs or breathes too much and viral RNA comes out, then it's going to be readily accepted by the host, by someone else who's there. So it's possible that places like California or Florida or the Caribbean maybe are doing better because there isn't as much transmission outside. Maybe like virus, maybe the virus is somewhat being killed by the heat, but I'm not 100% sure about that. I don't think that the virus in general spreads as much while people are outside. It's more when people congregate inside, get the virus and then come back, or when they go home, once they've gotten the virus, that's where it seems like the biggest threat is, in closed spaces.
Thank you.
Thank you. Administrator's iPhone, Mendy, please. Yes, we hear you.
Yes. Thank you, Dr. Hecht. Your presentation has been thought-provoking, comprehensive. Although you denied being an expert in infectious diseases, you certainly present a very well-rounded and very detailed understanding for some of us that may not have been able to access this kind of information. And so I just want to thank you very much. I know that you're not New York based, and some of the issues, the corona issues, especially in so far that it impacts and affects people of color, are skewed in a certain direction based on certain comorbidities and lifestyle and diet and underlying conditions, and so that that helps to drive up the numbers in certain underserved neighborhoods in New York City. I'm not sure what the answer is or response to that is, except to follow the rules, social distance as necessary, because if the underlying conditions and a significant percentage of the comorbidity impacts people of color across the board, then in my view, we start off from a bottom baseline, and then we have to climb to the mountaintop, you know, overcome the virus, which is respiratory in nature, but you know, if the comorbidities are significant, then, you know, we seem to lose in every arena. So I'm not sure what the answer is to that, except that there needs to be probably more education or more health initiatives that impacts people of color, because to be 13% of the population and still be between 30 and 38% of those affected by the virus, I don't know that the virus is picking and choosing, but if it's ending up coalescing around and impacting significantly people of color, then we need to do some health check around the disparities to see what's operating there. Do you have any thoughts?
Yeah, first of all, thank you. I really appreciate the compliment. That made me blush a little bit. But I will say that, you know, it is definitely disproportionately, like I mentioned before, affecting people of color, underserved populations in general, whether that's the Black community, African American community, or the Latino community, some parts of you know, the Native American communities as well.
Absolutely, that's correct.
And that has been long established for all sorts of diseases like hypertension and diabetes. And it's been studied, and there's a lot of literature on it. You know, it's multifactorial, obviously, but a lot of it does have to do with the disproportionate, you know, health care and social determinants of health, as I briefly mentioned. And this virus, it does really affect people who have underlying conditions. Anecdotally, I've seen that people who have diabetes don't do well with this virus. And we know that, you know, my patients who have diabetes, I'm trying my best to control it as much as we can, but really trying to limit their exposures. Heart disease as well, although it's hard to determine because a lot of people who have heart disease also have concurrent diabetes. So what I would say is that, you know, I definitely appreciate your point. It's very difficult. It's not different than any other medical condition. Unfortunately, it's like, you know, like the saying, the rich get richer and the poor get poorer. People who are unhealthy are really getting hit hard by this the most. And that's why we're trying to protect them as best as we can.
Thank you, Dr.
Thank
Hecht.
you.
Yankee, you want to take one?
Thank you, Dr. Hecht again. Does anybody have any questions? We could take another question or two before the doctor has to go back. If you have a question, just raise your hand, or you could just press the little emoji. Does anybody notice anybody waving their hand? I don't see anybody.
Well, some people are on the phone, so I'm not sure how they could.
Yes, let me see.
All right, Dr. Hecht.
You can also comment in the chat. You know, say you have a question in the chat. We can see that even if you're on your phone. You can see that.
Thank you very much.
Right. Oh, one second. We see a question. Mendel Persian, who's currently quarantining in Detroit, Michigan. He's raising his hand. I see him raise his hand. Please unmute Mendel Persian.
Yeah, doctor, I have a.
We can't hear you.
We can't hear you.
Hold on.
Now we hear you. No, unmute him. He's muted.
You hear me?
Yeah, we hear you now.
You hear me now?
Yes.
Yes.
Quick question. In a couple of weeks, when the subways are back up and running in New York City, what do you recommend for especially people in both our communities, in Crown Heights and in all communities? What do you recommend the best way to take the subway, especially with the turnstiles And when you're in the subway, there's people that might get close to you, which you have no prediction of. What do you recommend in New York City, which is one of the only cities that has a big transit system? What do you recommend? Should people go to work? Should they not go to work? How should they get to work? Also, people take a lot of Uber Poles in New York. So it seems like there's to get anything done in New York, it's you need to, there's a high chance of getting contact with people. And a lot of older folks, they're in harm's way when that happens. So what do you recommend with regards to that? Also, how do you get a PPP loan in New York City? I want to know that too.
That's a really good question.
I heard they weren't funding any of those.
It's a really good question. To be honest with you, this is kind of going to be a little bit of a cop-out answer. The best thing to do is not to go on the subway if you can all avoid it. I did live in New York, and the subways are going to be packed regardless, and the contact is unavoidable. If you absolutely have to go on the subway, I do the regular precautions that I would recommend to anyone, which is to put on a mask. When you get to work, if you can change your clothes, wash your hands with soap and water. For more than, sing happy birthday, wash it with warm water and soap. That's the best disinfectant that we have, better than hand sanitizer. Although you could use hand sanitizer as well. I would try to avoid it. If you can work from home, that's the best. If you can, drive, I know it's really difficult in New York. We don't really have a subway system here in California. So most people do drive. I have noticed that traffic patterns have picked up. So maybe people aren't socially distancing as much as we would like. And we'll see what, that could possibly be a reason for the uptick of cases here in my hospital and beyond. But I don't have a good answer to your question. I would avoid it if I can. But yeah, if you have to, just take as many precautions as you can.
Thank you, Dr. Dober and Yankee for coordinating. Again, I want to say that I think this is,
my sister is texting me that she needs the doctor home. So she said, don't take any more questions. He's got to come home already.
No more questions.
You got to give the kids a bath, she said.
We're living in unprecedented times, and I really think as a community, we have to unite. Crown Heights is one community. We're all New Yorkers. I think together we have to just help each other. You have an elderly neighbor, check in on them. If you want to do it by phone, some of them may be embarrassed to ask people shopping for them, but they should not be going to the stores. Somebody who's high risk or in quarantine, if you could deliver food or arrange a volunteer, we all could do something for somebody. And I think together as one community, we're going to face this challenge best. Thank you, Dr. Hecht. Thank you, Yankee. Before we close up, I want to ask the chair to close the meeting. Fred, please close the meeting. And after Fred speaks, we're going to close down the meeting.
Can I say one last thing, Yaakov?
Yeah.
Just, I have to leave, because of what Yankee just said, but I want to just say thank you so much for having me. Thank you to all the healthcare workers in New York, whether it's the nurses, the doctors, the respiratory therapists. Today I spilled my water on the way up the stairs, and one of the people from environmental services was there within about 15 seconds to clean it up. And I told her, you're a hero the same way I'm a hero. And so everyone is doing their best. Those who are staying home, that you guys we're all part of the solution together. So thanks again for having me. I got to sign off, but thank you again.
Thank you, doctor. Thank you very much.
Thank you, doctor.
Thank you.
Yeah, I mean, I don't know how you follow that up. There really is no follow-up. I think I want to again thank Dr. Hecht for really giving us some good information. And it's all about, we just have to follow best practices. We got to keep our hands clean. We got to make sure we're respecting everyone in terms of making sure we're wearing facial covering if we're going someplace. Again, if you're touching things, don't touch your face. It's a habit that a lot of us have, and I had to break out of it. Carry a napkin or something like that. So if you have to touch your face, make sure you're doing that. But making sure we're doing that, but respecting everyone else as well in terms of making sure that the covering is not only for you, but it's also keeping everybody else safe as we do it. Again, I just really want to thank the chairman and the committee for an exceptional meeting. This is really well done. And definitely I would love to talk to you as well in terms of your experiences, because I do believe that this mode of meeting and communicating and working is something that we should really seriously be looking at as a community board in general, because I think there are some efficiencies. Definitely, there's some things about being face to face, but we should be looking at different ways we can work together and still being able to get the work done while keeping everyone safe. But with that, I'm just looking forward to the time when I can see everyone. But until then, it's great to see you all virtually at least. And again, thank you for all the great work you're doing.
Thank you, everybody. Mandy.
Thank you.
Thank you.
Are you gonna close the meeting, or that was news?
The meeting closed. Wendy, how do you shut the meeting?